Good morning, everyone. My name is Elizabeth Roldan. I am here from IMAC Insurance, and IMAC Insurance is the insurance broker for the Township of Montclair. We are here to help you with everything and anything related to your medical prescription and dental benefits. We are also your claim advocates, so if you ever have a question or claim matter throughout the year, feel free to give our office a call or send us an email. Our representatives usually get back to people same day, most of the time within an hour or two. So we are very much available to help you with any questions that you have about your benefits, claim matters, and especially now during open enrollment, because of the high increases that are coming for 2026. I know that there are a lot of questions about alternative plan options that members are interested in learning more about other offerings. So please don't hesitate to reach out directly to us. We're here to help you. And really, I think the biggest takeaway today is that October 31st deadline for open enrollment. That is a hard deadline imposed by the state health benefits. So you really do have until midnight of Friday, October 31st to go ahead and make any changes that you'd like to your benefits, but they will not allow any changes to happen after the fact. So that's a very important takeaway. Open enrollment began last week on October 1st, and again, we'll run through October 31st. All changes that you're looking to make can only be done through the Benefit Solver portal. The Benefit Solver portal has been out for about 5 years. I still come across members from time to time that have never been on it. So it's important that if you are looking to make a plan change, that you make sure that you have access to Benefit Solver sooner than later, because if you do have to call the tech support line to get access to it, I know that they're experiencing very high call volume now during open enrollment. So please make sure that your access to Benefit Solver is working. And even if you're not making any changes, it's always a good idea to double check that your coverages, your dependents, and that all your information is correct within the Benefit Solver portal. For example, I know a lot of the times when employees are making a plan change and they process it through Benefit Solver, and their ID cards don't get to them on time, it could be because they moved and just didn't update their information within that enrollment system. So it's always a good practice to go ahead and double check that everything is up to date in the Benefit Solver portal. Benefit Solver also offers an app called My Choice Mobile. So if you don't want to access Benefit Solver on your computer, you can do so through the My Choice Mobile app, and that's available for you to download as well. But again, you do not need to take any action if you're not making any changes or adding any dependents. But as I mentioned, we do strongly recommend that everyone double check their plan elections and who they're covering on their plan. If you've never been on Benefit Solver, this is the website. It's mynjbenefitshub.nj.gov. If you've never registered, you would need to go ahead and register for the first time. But if not, you would be entering in your username and password. I know that they have a two-factor authentication, so they will be sending you a text on your cell to verify that you are the person who has access to this and can log into the portal. When you log in, this is what your portal will look like. Across the top, you'll actually see a banner with a countdown letting you know how many days are left in open enrollment. But again, very important that you have access to this, because if you don't, only the tech team at Benefit Solver can help you have access to your portal. And if you are downloading the app from the Google Play Store or the iOS Apple Store, this is what the app looks like. It's called My Choice Mobile. And again, the same items and changes or anything like that that you can make on the website, you can also do through the mobile app. For those of you that are adding a spouse or any dependent children for the first time, the state does require for verification. Again, this is only if you are doing this for the first time. If you already have your spouse and or dependent children enrolled, you would not need to go ahead and go through this process. But if you've never done that before, there are certain forms that the state will require that you can upload through the Benefit Solver website, or you can take a picture of it through the My Choice mobile app. And for example, if you're adding a spouse, you would need to supply a copy of the marriage certificate as well as the joint tax return. Or if you're adding a child, you would just need a copy of their birth certificate. And while we understand that open enrollment happens during the month of October, If you do have a child or you get married outside of open enrollment, you do have 60 days to go ahead and make those changes directly on Benefit Solver, because that is called a qualifying life event change. Okay. So with open enrollment for this year, you do have the same 10 plan options that you did last year. I know for the most part, most of the employees that I speak to are either in the Direct 10 or the Omnia plan, or the Direct plan. So those three tend to be the most popular options, Direct 10 being the most popular one, as it is also the most benefit-rich plan. It's also the most expensive plan. So that is something to definitely make a note of, especially with the significant double-digit increases that are happening next year. Part of what we're going to cover today is just to do an overview of the plans, to see what the differences are, and potentially, if you're looking to save a little bit on your Chapter 78 contributions, this may be a good time to learn more about another plan that can provide you some cost relief. And if you do make a plan change this year, at most you're committing to it for a year, because you'll have open enrollment again next year to go ahead and make any benefit or plan changes that you'd like. We do have comparisons side by side on the IMAC benefits portal. You can also view them on Benefit Solver, so whichever one is easier for you to view, that's certainly an option for you. But definitely, when you're thinking about making a change, consider how you're utilizing your plan, not only your medical plan, but your prescription, because whatever medical plan you choose has a corresponding prescription plan attached to it. So it's important that you take a look at that, especially how are you using your out of network? What prescriptions are you and your family on? So that those are important utilization points to take a look at, to make sure that while you're going to save money by moving to another plan, it also has to work for you medically, to make sure that the uh, medications and the doctors and the out of network that you're utilizing all will work for you as well. So one of the plans that we like to focus on, because it has a lot of similar benefits, is the Omnia plan. So the Omnia plan does utilize the same network of doctors as are in Direct 10 and in Direct 15. One of the biggest takeaways and one of the major differences is the fact that the Omnia plan is an in-network only plan. And while it will provide you savings, again, there is no out-of-network coverage. But any doctors that you're seeing today in network under Direct 10 and under Direct 15, they are going to be in the Omnia plan. The Omnia plan is structured into two tiers, Tier 1 and Tier 2. So for example, if you go into a Tier 1 provider, that's a $5 copay. If you go to a Tier 2 provider, that's a $20 copay. Same thing with specialists. It's between Tier 1 and Tier 2. Tier 1 would be a $15 copay, and Tier 2 would be a $30 copay. The emergency room is slightly higher at $100 for the copay, but again, like it is under Direct 10 or under Direct 15, it is waived if you're admitted into the hospital. And just to put some options here together, as I mentioned, the Direct 10, the Direct 15, and the Omnia plan, those are really the three most popular and highly enrolled plans, and with Direct 10 being the most popular one. As you can see, the network is this, again, in the state, you can choose between Omnia and Aetna. I'm sorry, between Horizon and Aetna. So that's why we have it listed here. But if you are in Horizon, for example, the network of doctors, as I said, across all four of these plans is the exact same network. If you are in Aetna, there is a network difference with the Omnia plan, but I believe for the most part, most individuals that I speak to are in Horizon, and like I said, they have the same network of doctors. The national network is the same across the board. If you're in Tier 1 under the Omnia plan, the coverage is only in New Jersey, but a Tier 2 provider would also have the same national network. So with Omnia, you do have coverages outside of the state of New Jersey available to you. So for example, if you have a child that is away at college, there is coverage for them if they should need to and they live in another state. Again, the copays will vary slightly based on the plan that you're in. And again, all four plans offer your annual physical, which everyone should be taking advantage of, at no copay. So you do have your physical every year at no cost. And again, you do have deductibles and out-of-pocket max, obviously on all four plans, but Under all 4 plans, there is no in-network deductible or tier 1 deductible. If you go out of network or in the Omnia plan under tier 2, that will vary per plan. And again, the out-of-pocket maximum, and I like to take the time during open enrollment to explain the difference, that your deductible is the money that you would lay out before your coverage begins to kick in and cover the costs of your procedures, doctor's visits, etc. But your out-of-pocket max is the maximum that you would spend out of pocket in a calendar year. So for example, I'll use the Direct 10 as an example. If you are someone who is in network, your maximum out of pocket for the year for an individual is $400. So if you meet $400 worth of services between coinsurance and copay in network, the plan will pick up everything else at 100% for the rest of the year. So that's really the difference between deductible and out-of-pocket maximum, or MOOP, as it's also known. None of the plans require a referral. Your labs are the same in all 4 plans, with LabCorp and Quest being the in-network labs. And outpatient surgery is covered at 100% in network or under tier 1 in Omnia. And if you do go out of network or in tier 2, you would be subject to your specific deductible and coinsurance. Your emergency room copays, again, differ slightly. So again, depending on the plan that you're in, you would go ahead and pay that copay. And again, that is waived if you are admitted into the hospital. As I mentioned, your medical plan choice would dictate your prescription plan choice. So if you are looking to make a plan change, take a look at this comparison. I know that Braden and Alicia emailed it out. It's posted on the IMAC benefits portal, on Benefit Solver, and on the State Health Benefits website. So it's important that you take a look at this just to see how your medication would be covered, how your prescription costs would be covered if you should switch into another plan. I know that at Township of Montclair, the police have co-insurance for their medical, or as it's known, MMRX, where your prescription is included with your medical plan. But if you are in one of the other collective bargaining units, you are under the RX copay. So it's important that you know how that works as well. So next steps, if you aren't making any benefit changes or adding any dependents, you don't need to go ahead and take any action. This is a passive open enrollment with no action required. But if you are waiving for the first time, or you would like to make a plan change, you do have until, again, October 31st to make that plan change. We highly encourage you to make sure that you have access to Benefit Solver, that you review your plan options, whether it's on the IMAC benefits portal or on Benefit Solver, just to ensure that the change that you're looking to make will work for you and or your family. At most, you're committing for a year in whatever plan you decide to either stay in or change to, because you will have open enrollment again next October for an effective January 1st date, as it is every year. Your open enrollment is in the month of October with all your benefit changes effective January 1st. And again, the big takeaway, October 31st is that deadline for open enrollment. No enrollment changes will be allowed after that deadline. So it's very important that you don't leave it for last minute if you're looking to make a change, and that you do so by October 31st. As we keep on mentioning throughout the call, the IMAC benefits portal is where everything that we have presented today is housed, besides the fact that it's on the State Health website, as well as on Benefit Solver. But if you go to imacbenefits.com and type in guest key Montclair TWSP with no space, capitalizing the M, capitalizing the T, you will see everything that we've discussed today, and we will be sharing a link for the recording of this webinar as well for anyone that wants to view it again, or anyone that couldn't make it live that would like to view it at their own time. And as we mentioned previously, while open enrollment is during the month of October, we understand that life happens outside of open enrollment. So again, you do have 60 days to complete any changes as far as your enrollment. If you get married, if you have a newborn dependent child, you have those 60 days. You have 30 days, however, to terminate coverage if you're gaining it elsewhere. So that's important to note. So if you are leaving the coverage here at Township of Montclair to, let's say, go on a spouse's plan elsewhere, you do have 30 days to terminate that coverage. And again, you would be processing that directly on Benefit Solver. whether you're looking to enroll or make that termination. Coverage is retroactive to the date of the event. So, for example, if you get married on September 1st, but you don't get around to enrolling your new spouse until, let's say, October 7th, you do have 60 days to do that. So once you do it on October 7th, it would be retroactive back to the date of September 1st. So again, coverage is retroactive as long as you process it before the 60-day deadline of enrollment. And again, open enrollment is your annual opportunity to go ahead and remove or delete dependents. If you have dependents that are aging out, they will be removed automatically. Dependents age out at the end of the year in which they turn 26. So those dependents will be removed automatically. But if your dependent is gaining coverage elsewhere and you want to remove them from your plan, this is definitely your opportunity to do so. And again, changing between plans, waiving coverage, or enrolling of coverage if previously you have waived your coverage. And just to touch upon those dependent children that are aging out, as I mentioned, they do age out at the end of the month and at the end of the year in which they turn 26. So in the state health benefits, all dependent children age out December 31st of every year once they turn 26, and they will be automatically offered COBRA. And that's going to be mailed directly to the address that is on file for that dependent child. Depending if they meet certain criteria, they could be eligible for something called Chapter 375, which we will get into momentarily. And if you do have an overage child with special needs, there is coverage continuation for overage children with disabilities. If you have any questions about that, certainly feel free to reach out to us. I know that Benefit Solver has a lot of information about this. We also have a lot of information about this on the IMAC benefits portal as well. So Chapter 375, again, for dependent children that age out, if the child is unmarried, has no dependent children of their own, lives in the state of New Jersey and or is a full-time student elsewhere, and is not eligible for coverage under another group plan or entitled to Medicare, they can enroll in Chapter 375 or Dependent 31 in the same medical and prescription plan that you are currently in at a fraction of the cost compared to COBRA. COBRA charges 102% of the premium. And some people get sticker shock when they see that because they think that that's an annual fee, and that, you know, a lot of the times it's so expensive it looks like a mortgage payment. But under Chapter 375, they pay about 66% of the cost of the premium. So while it is still expensive, it is not as expensive as COBRA. So if you do have a child that is aging out that does meet this criteria and are interested in enrolling, again, Benefit Solver has all the information that you'll need on there to complete that enrollment, or you can reach out to us and we'll help walk you through it. And you would then be on a direct pay basis with the state for that coverage for that child. And again, only for medical and prescription benefits. Dental and vision benefits do not get applied or are not eligible for enrollment under Chapter 375. For those of you looking to make a plan change, if you're interested in searching up your doctors, which, like I said, if you're in Direct 10, by moving to Direct 15, Omnia, or the Direct plan, all of those share the same network. So no need there to search for providers. But again, if you are looking to switch into maybe one of the other plan, like the HMO or the 2030 plan, for example, you can do the search for that provider and or maybe a facility at Horizon's website, which is horizonblue.com, and you would click on Doctor Finder, and it's right on the top right-hand corner. Same thing with Aetna. If you're looking to go ahead and do a search for a provider, if you're looking to enroll in an Aetna plan, you can go to the aetnastatenj.com website and then do a provider search there for any of the plans that are offered through Aetna through the state health benefits. With Horizon and with Aetna as well, you do have a gym reimbursement that is available under Horizon. It's called Horizon Be Fit, that by going to the gym 12 times or more a month and or walking 10,000 steps, you can go ahead and earn a $20 a month incentive up to $240 a year, again, for going to the gym, and you can use that towards paying for your gym membership, etc. But again, that is a wellness incentive that is offered to state health benefits employees. Horizon Blue 365 is also a discount service that Horizon offers. with discounts for things such as Skechers sneakers, meal service delivery, LASIK eye vision surgery. So there's quite a few of promotions and deals that they offer exclusively to Horizon members in any of the plans. So if you go to Blue 365, you can go Blue365deals, excuse me, .com. You can go ahead and register to get weekly emails of different discounts that they're offering to Horizon members. Again, if you're in Horizon and as well as with Aetna, you do have a mobile app available for the Horizon members. This is what the app looks like in your Apple iStore or the Google Play Store. And again, what I like about the Horizon app is that if you forget, or the Aetna app, if you forget your ID card at home, the app will allow you to have a digital copy of your ID card pulled up that you can present at a provider's office or at any facility that you're receiving treatment at if you forget your ID card. And the last thing that we want to cover is NJ Well. This is a wellness incentive program offered in the state health benefits. By completing certain activities such as your annual physical and other preventative services, you can accrue points to earn a $250 gift card for yourself and or if you have a spouse that is enrolled in your plan. The NJ Well program runs every November 1st through October 31st. So we are nearing the tail end of the 2025 year, but the next 2026 year begins on November 1st. And if you go to nj.gov/NJWell, you'll be able to see the criteria for meeting the points that need to be accrued in order to earn that $250 gift card. With that said, that really does conclude our webinar today. We are very much here to help you go ahead and figure out what plan options will work for you. Also discuss with you what that increase will look like. I know that we've shared the links on the IMAC benefits portal of the calculator that you can go ahead and utilize to see what your numbers are going to be come January. But if you have an issue figuring that out, or would prefer that we do it, we are totally here to go ahead and help you. So feel free to email or call our office. I don't see any questions that came through on the chat. But again, if you think of something afterwards, we are here very much to help you during this open enrollment period so you make the best decision for your family and or yourself. I appreciate your time this morning and thank you very much. Have a great rest of your day. Oh, before we conclude, I keep hearing, I see a question that came through. Person is asking, how much is Horizon going up? I know that the medical portion of it is going up about 32.7%. Prescription is going up about 62.9%. These are definitely the highest increases that the state really has ever had. I would highly encourage you to double check the calculator just because depending on the collective bargaining unit that you're in, that may vary slightly. So if you're in police, for example, where you have the MMRX, it is a different percentage. But again, the calculator will give you specific information as to what your annual number for 2026 of your contributions will be. But again, feel free to call our office and we can walk you through that. The rates are exactly the same whether it's Aetna or Horizon. That's a great question. In the state health benefits, both Aetna and Horizon are carriers. They both offer the exact same plans at the exact same rates. The only difference being that the networks are different because if you're with Horizon, you'd be using their networks versus Aetna, you'd be using the Aetna networks. Let's see what other questions we have here. Okay, perfect. But again, if you think of anything, person here is asking, is Omnia going up? Yes, everything is going up. This is an increase across the board on all plans. So unfortunately, due to many factors, rising costs in the healthcare industry, claims experience in the state health benefits, all of those are factors that are impacting this very significant increase, and it is across the board. And it is not just happening at the state health benefits. That's one of the questions that we're getting a lot. Is it just in the state? And the answer is no. It's happening with, school districts and municipalities and private industries that have coverages even with carriers directly. So Unfortunately, this is an industry-wide, very large increase here. So yes, it is going to impact Omnia as well. All right, perfect. Thank you so much for your time, everyone. And again, we are here to help you through this open enrollment period and would love to talk to you one-on-one about what works best for you and your situation. Thank you so much. Have a great rest of your day.